Last week, Fox's Griff Jenkins reported that 3 cases of tuberculosis were reported among migrants crossing the southern border. Dr. Frank Contessessa joins me now to talk about this. So, Doctor, how worried should we be about this? I mean, the last I heard, tuberculosis is very transferable, no?
Well, good morning, David. It's nice to be with you today. Yeah, there is reason for concern here. So tuberculosis is the #1 infectious disease killer across the world.
Wow.
There's still 2 million deaths worldwide from tuberculosis. And one of the consequences of, uncontrolled immigration and not screening these people is that they're going to bring diseases like this into our country that we basically had virtually eliminated decades ago. So when people come in unchecked and unscreened, this is the kind of risk. I think back to there's a scene in Godfather 2 when young Vito Corleone as a little boy comes through Ellis Island, like my family came through 120 years ago, and they were screened for infectious diseases. And the little boy was quarantined in the medical wing until his health could be assured. We're not doing anything like that 120 years later. People are just pouring across the border.
Unbelievable.
And so that is a real risk. Yes,
you think as modern as we have become in our ability to control diseases and everything, that the simplest things are not being followed at the border right now, and that would lead to very contagious diseases. I want to switch to another subject. President Biden is encouraging other people to, quote, follow my example after he got the updated COVID booster and the flu vaccine. And now the CDC itself is recommending COVID vaccines for 6-month-olds and above. 6-month-old babies, doctor, really? Would you recommend a COVID vaccine for a 6-month-old?
This is an easy one, David. No, I would not. And to tell you the truth, with this new booster, I'm not really recommending for much of anybody. Maybe you could make a case for the very, very highest risk people. But no, for most people, I'm telling them avoid this. The benefits no longer outweigh the risk of these vaccines. We're dealing with a very mild illness now. And the vaccine that we're dealing with today is a strain from January and February. It was based on the XBB Omicron strain. That we're 3 strains past that now. So no, I'm still recommending the flu shot, but I'm not really pushing the COVID boosters, particularly in young, healthy people.
And doctor, the fact is that the CDC itself and the data coming from Pfizer shows that the chance of hospitalization and death from the vaccine for children is greater. I mean, it's minuscule, but it's greater than the chance of hospitalization and death from the disease itself. So it makes no medical sense, does it?
You're absolutely right. Even from the beginning, when COVID was more of a severe disease, when we were seeing a lot more hospitalizations than deaths, the risk to a healthy child was precisely 0. Any deaths that occurred in younger patients, tragically, they were people who were already sick. These were sick kids dealing with cancer, chemotherapy, transplants. Yeah. For healthy young kids, even early on in COVID, the risk was 0. The risk of the vaccine was always greater than the risk of the illness.
Doctor, great to see you. Thank you so much for being here. Appreciate it.